So thank you everyone again for joining this call, the Transportation and Climate Initiative, Why It Matters for Health and Healthcare. I want to thank our valuable partners who helped us put together this call. Series, which is a sustainability nonprofit organization working with the most influential investors and companies to build leadership and drive solutions throughout the economy. The American Lung Association, which saves lives by improving lung health and preventing lung disease through education, advocacy, and research. Transportation for Massachusetts, which is a diverse coalition of more than 70 partner organizations with a stake in improving transportation across the Commonwealth. The Acadia Center, which is working to advance clean energy and transportation policies across the Northeast, and which helps to coordinate regional advocacy around TCI. And then, of course, our sister organization, Practice Green Health, which many of you are members of. Today, we will hear from 3 speakers. Will Barrett is the Clean Air Advocacy Director with the American Lung Association in California. And Will leads the Lung Association's work on California's clean air and climate change programs, focusing on vehicle emissions and technology standards, smart growth, and clean fuel policies. Then we'll be hearing from Christopher Dempsey, who is the Director for Transportation Massachusetts. As the Coalition's Director, he was also formerly the Assistant Secretary of Transportation for the Commonwealth. Excuse me, my dog is barking. 1 second. I was worried that would happen. That is one of the perils of working from home. But I was introducing Christopher Dempsey, who is the Director of Transportation for Massachusetts and former Assistant Secretary of Transportation for Massachusetts. Sorry, Chris, about interrupting your bio. He's also worked as a consultant at Bain & Co. on a number of local and statewide political campaigns, and at a transportation technology startup that provides mobile ticketing for transit systems in New York, Boston, and Los Angeles. And then finally, we'll be hearing from John Carlson. He oversees Ceres state policy work along the East Coast, and he works to promote renewable energy, energy efficiency, and clean transportation by utilizing the unique perspective of the business community in the policy debate. For those of you who are unfamiliar with Healthcare Without Harm, Healthcare Without Harm creates change among hospitals and health systems through education, training, peer learning, and implementation tools focused on our core sustainability efforts. We aggregate the influence and purchasing power of the health sector, and we drive the entire marketplace towards sustainability and advocate for policies that will create global change. As the only sector with healing as its mission, we believe that healthcare has the opportunity and the obligation to use its ethical, economic, and political influence to create an ecologically sustainable, equitable, and healthy world. The climate program here at Healthcare Without Harm works to foster climate-smart healthcare in hospitals and reframe the climate debate by broadening the conversation to include a powerful public health dimension. And we have a 3-pillar climate-smart framework for health system engagement on climate and health. We envision a health sector that radically reduces its own carbon footprint and implements low-carbon healthcare delivery, using its supply chain leverage to drive market transition to a low-carbon economy. We envision a health sector that has facilities that are prepared for climate impacts and help to anchor its communities and regions for greater community resilience. And leadership, where healthcare institutions and professionals are acting as critical messengers for rebranding climate change as a public health threat and becoming powerful advocates for climate-smart policies at all levels of government and healthcare oversight organizations. We work very closely with our sister organization, a membership organization, Practice Green Health, which works to create change among hospitals and health systems through education, training, peer learning, and implementation tools for healthcare sustainability. And also GX, which was founded in 2016 by both Healthcare Without Harm and PGH and several leading health systems, and is a supply chain organization to help hospitals identify, source, contract, and purchase sustainable products and services. At Healthcare Without Harm, we embrace smarter transportation solutions for hospitals and communities that protect health, improve employee satisfaction, and save money. We know that the more miles we travel, the more air pollution we create, and the more GHGs we emit, driving climate change. However, enacting more sustainable transportation practices can lead to improved employee health, drastic reductions in the number of single occupancy cars parked on site, fuel cost reductions in the hundreds of thousands of dollars each year for health systems, and improved air quality and benefits to the communities. So I would be remiss on this call if I didn't mention all of the resources that Practice Green Health has for helping you develop more sustainable transportation at your healthcare system. So we've developed, at Practice Green Health, we've developed goals, tools, and resources to help you think through and address your health system's vehicle emissions footprint step by step, including a Practice Green Health Transportation Toolkit with a Get Started guide, a checklist, a Data 101 call on establishing a baseline goals and metrics. And if you'd like to learn more information about that, you can contact our lead on transportation, Julie Moyle. Now, without further ado, I am going to pass it over to Will Barrett, who's going to talk about the health impacts of transportation.
Hi, thank you so much for having me. I am Will Barrett with the American Lung Association in California. It's my pleasure to be here with you today. I've been honored to be able to work with the Healthcare Without Harm team in California, and glad to be able to join you all today for the broader discussion. So the American Lung Association this year launched our Year of Air Pollution and Health campaign to increase public education and engagement around air pollution, climate change, and health. We're partnering with more than 20 health organizations across the country in this campaign, including Healthcare Without Harm, really to highlight a different aspect of air pollution and climate change every month. Recently, we've looked at the interaction between asthma, allergies, and climate change. The month of June was dedicated to focus on impacts to moms and kids. And coming up next month, we're looking at the health toll of heat events and ozone pollution, which have a clear connection with climate change impacts as well. Going on to the next slide, in April, we released our 20th annual State of the Air report by the American Lung Association. And this report reviews air quality monitoring data from across the United States for counties across the country that have an air quality monitor for either ozone or particle pollution. And then with all of that data, we look and apply a grading system and a ranking system so that we can get a sense of which communities have the greatest burdens of air pollution across the country. Oh, I hit the button too soon, sorry about that. This year, we found approximately 43% of Americans live in counties that earned a failing grade in our assessment during 2015, 2016, and 2017. Those were the 3 years that we looked at in the report, which also happened to be the 3 hottest years on record. And as a result of that, we saw significant increases across the country in ozone pollution. That's our summertime smog that does increase in form when we have tailpipe emissions, for example, mixing on hot sunny days in the atmosphere and form into ozone that threatens public health. We also saw significant increases, especially in the western United States, in particle pollution due to the vast majority of those states on the West Coast out here having major wildfires, especially in 2017, that were included in this year's report. These additional climate stresses come on top of the everyday burdens of pollution that we fight against that are increasing health impacts, especially notable in the transportation sector. And ultimately, we find the climate change impacts are really just making the job of cleaning up the air and protecting public health that much more difficult. So there are many ways that ozone and particle pollution impact lung health, heart health, and we look at ozone and particle pollution because they're the 2 most widespread pollutants affecting health across the United States. And among the ways that we know that these pollutants can injure or affect lung health, that includes premature deaths, increased asthma attacks, causing lung cancer, heart attacks and strokes, and other cardiovascular impacts, as well as challenges to developmental harm for children and reproductive harm, including premature birth and low birth weight. So many ways that unhealthy air can impact public health. In part of the report that I mentioned, we do rank cities across the United States for their levels of pollution, and within the TCI region, 4 cities made the most polluted, the 25 most polluted by ozone cities in the United States: in New York, Washington, Philadelphia, and Hartford. Of these 4 cities that made the top 25 most polluted list, 3 of them actually saw increased ozone pollution compared to our last year's report. Again, a large part of that we see due to the increased temperatures in those 3 hottest years on record that we captured. Overall, 17 of the top 25 most polluted cities for ozone, or that summertime smog, actually saw increased ozone pollution over the past year, again coinciding with those extreme heat events. And we know that air pollution burdens are not equally felt. Everybody's impacted by unhealthy air, but there are certain populations that are at greater vulnerability and face greater challenges. Here we've summarized a few of the populations at greater risk due to those elevated ozone or particle pollution levels in the TCI states. So we've kind of summed up all of these states and looked at the number of children living with asthma, adults living with asthma, people living with heart disease, as well as people living in poverty. And notably, about half of these more vulnerable populations live in communities that we signed an F grade for air quality in our most recent report. Really just wanting to stress here that while everyone's at risk due to unhealthy air, there are more sensitive populations, and in many cases, the burdens of environmental pollution are not equally experienced. So as far as transportation pollution, across the United States, transportation sources represent the largest source of harmful emissions, both in terms of smog-forming ozone pollutants, as well as our carbon footprint, our carbon pollution. In 2010, the Health Effects Institute reviewed over 700 studies on transportation pollution, looking at the definitive statements on health impacts of transportation pollution, and they concluded that transportation pollution causes asthma attacks in children. They also concluded that traffic pollution may cause a wide range of other effects, including the development of asthma in children, impaired lung function, premature death, death from heart health issues, and a wide range of other impacts. And we know that as these pollutants contribute to climate change, that we are also dealing with the fact that climate change is first and foremost a public health issue. In 2016, the American Lung Association in California, along with our colleagues in 9 other states, so we looked at 10 states, and released a report called The Clean Air Future, really looking at the benefits of zero-emission transportation across those states that have a zero-emission vehicle program. We found that in those 10 states alone, the health and climate costs of traffic pollution amounted to about $37 billion in 2015. So that came out to roughly $18 per fill-up of an average gas tank when you consider the combustion of those gallons of gasoline in our passenger vehicle fleet. We look at adding that untold cost of health and climate burdens and those significant impacts of our transportation sector, both to local health, health in our most disadvantaged communities and vulnerable populations, and the impacts of transportation and traffic pollution on our climate. We know that significant and dedicated attention is needed, and we're pleased to see that dedicated attention shaping up and moving forward through the TCI discussion, and glad that we're bringing together folks today to talk about the health messaging component of that we think is so important. In California and throughout some of the other states where the Lung Association is most active, we've been heavily engaged in state-level policies to address transportation pollution as the threat to public health and our climate that transportation sector pollution is. We see that there are significant ongoing opportunities to support policies and the investments needed to accelerate the transition to zero-emission vehicles, both in terms of the passenger vehicle sector, but also in the heavy-duty, medium and heavy-duty sectors, making sure that we're putting the focus on our transit buses, our school buses, goods movement, delivery trucks, and other kind of heavier-duty technologies that are emerging and can play a significant role. We also know that we need to design our communities in healthier ways and offer more transportation choices as those communities are designed and grow, so that people have real alternatives to driving through more expanded transit, more active transportation infrastructure, so safe places to walk and bike as alternatives to driving whenever possible. And then finally, looking at, again, this issue that I noted before of the unequal burdens of transportation pollution, and making sure that those communities that have faced elevated burdens of unhealthy air for so long aren't left behind as these policies move forward. So really making sure that these historically overburdened communities at greatest risk to local health impacts of transportation pollution and the growing risks, health risks due to climate change, benefit from these transitions to zero-emission technologies, renewable energy, smart growth, or more walkable, bikeable, transit-oriented communities, making sure that these communities really do benefit as these policies move forward, and that as investments are made, we really do prioritize investment in these communities to make sure that all communities benefit as we move forward. So with that, I will kind of close out my talk here and put up my contact information, some additional resources, and really do encourage all of our partners in the health community to speak up wherever possible on the topic of climate change and reducing the local air pollution burdens associated with transportation pollution. We do have a collective voice, and I think whenever possible, we can make the case that these issues related to transportation pollution are first and foremost health issues, and that they need to be addressed as quickly and as efficiently as possible. So thank you again for having me, and I look forward to the rest of the program.
Thank you so much, Will. And with that, I'm going to pass the presentation capabilities over to Chris Dempsey, who is, again, the Director of Transportation for Massachusetts.
Good afternoon, everybody. Thanks for joining today. And Will, thank you for that great level setting and context as we approach this problem. So talking broadly about air pollution across the country, transportation is now the largest source of greenhouse gas emissions and air pollution. It represents, in a state like Massachusetts, roughly 40% of all greenhouse gas emissions. So the way to think about that is that we now have more pollution from our tailpipes than we have from our power plants. And there's actually a good story to tell here, which is that we've made a lot of progress on the power plant side and the electricity generation side. About a decade ago, the states that you see in blue here joined something called RGGI, the Regional Greenhouse Gas Initiative. And since RGGI was put in place, we've seen emissions come down about 35% across the region. The program has generated more than $3 billion in proceeds from energy efficiency programs. Electricity bills have actually come down for consumers during that period of time, and the economy of the region has grown by more than 30%, and it's actually grown faster than the rest of the country as a whole. We've also seen public health benefits from the RGGI program. Apt Associates estimates that somewhere between 300 and 830 lives have been saved. We've had more than 8,000 asthma attacks avoided, 39,000 lost workdays averted, and more than $5.7 billion in health savings and other benefits from the Regional Greenhouse Gas Initiative program. And that program is really a cap and invest system. What the states did about a decade ago is they came together and they said, we're going to set a cap on the amount of emissions that can come from the electricity generation sector. And that cap is going to lower over time. And what you see here is how the states have decided to lower that cap as they look to the next 3 or 5 years in the future. What we want to do in transportation is to try to have that same impact. You see on this slide here that as those electricity emissions have come down, transportation's been relatively flat. And so what the states that are part of the TCI, or the Transportation and Climate Initiative region, have done is they've said, let's look at the model of RGGI and see if we can apply it in some way to transportation. So all of the states you see here in green are part of the TCI process. And we'll talk about how some are more involved than others, but every state you see on this map is part of the conversation. So these states have come together. They're working with the Georgetown Climate Center as their sort of administrator or assistant on this program. And they're saying, look, we want to address air pollution and climate emissions from transportation. We want to accelerate the adoption of zero-emission vehicles, cleaner infrastructure. We want to promote walking, biking, and public transit. And we want to broadly modernize our transportation system while we bring down emissions. Over the course of 2018, they held a series of listening sessions around the region, and that resulted in a report towards the end of 2018 that came up with what they had heard, essentially, repeating back to the public what they had heard from industry, from business, from advocates like us, from institutions, from the public at large. And that resulted in December of 2018 in a statement by governors from these states: Connecticut, Delaware, Maryland, Massachusetts, New Jersey, Pennsylvania, Rhode Island, Vermont, Virginia, and the District of Columbia, all saying that over the course of 2019, they wanted their state administrations to work together to come up with a solution to the transportation pollution and climate problem. Now, Georgetown Climate Center has done some initial work on this, and they have some really impressive estimates for what a cap and invest system could do in transportation, including allowing the investment of more than $3 billion annually in the Northeast and Mid-Atlantic states, creating 100,000 new jobs across the region, and making people's lives easier in terms of reducing congestion, in addition to all of the public health benefits that we'll see. So how would a cap and invest system work for transportation? We'll dig into that a little bit. But again, it's important to know that there are already successful models in place. We have the acid rain program in the 1990s, which helped address that issue. We have the Regional Greenhouse Gas Initiative, which has worked very well on the electricity side. And then we have the Western Climate Initiative, which is a cap and trade system across the entire economy that's working in Quebec and California. It's also important to note that cap and invest doesn't operate in a vacuum. It's not going to be the sole policy that we need states to adopt. It could be a cornerstone policy, but it needs to be surrounded by a whole other set of policies that will help it succeed. So here's what the states need to do as they're investigating and designing this program. They need to determine what are the sources of CO2, what will be covered in terms of the different contributors to CO2 emissions. They need to decide how aggressively to set the cap, or how quickly they want to reduce emissions from the transportation sector. And then they need to determine where that point of regulation is. So who actually is going to be responsible for reporting and essentially accounting for those emissions. So think about a cap and invest system like this. There are entities that are responsible for that pollution, and you could say that for every ton of pollution that they create, they need to purchase in the cap and trade or cap and invest market one allowance equivalent to that ton of emissions. And they need to then purchase it and submit it back to the states where that emissions is taking place. The proceeds that are generated from the purchase of those allowances are then reinvested back into the states where those emissions are occurring. So what might that look like in practice? Well, this is a photo of wholesale distribution trucks that are filling up essentially at an oil refinery somewhere in the Northeast region. And they are going to take that fuel and they are going to drive it into the region, or maybe it's already in the region. They're going to drive it to gas stations that exist across the region. And that point of transaction is probably the place where it makes the most sense to have it be the point of regulation. In a state like Massachusetts, there's roughly a dozen companies that do that importing and that distribution to the thousands of gas stations that we have in the state. And so it's a nice point it's an elegant point, so to speak, where that regulation can occur, because you're not regulating thousands of entities, you're only regulating dozens of entities. So you're probably thinking, well, wait a minute, if they're having to purchase these permits, what's that going to mean in terms of fuel costs? And I wanted to just give a kind of rough breakdown of what that might mean, especially for a set of healthcare providers and hospitals that might be operating van and shuttle services that are purchasing gasoline. So on the very high end of the estimates today, there is a sense that the TCI program, or Reggie for Transportation, could potentially increase fuel costs by up to 15 cents per gallon. Now, at roughly $2.60 a gallon today, and that number obviously goes up and down, you're talking about maybe a 6% increase in fuel costs. I think the number could end up being much lower. The states could decide that they don't want to do 15 cents a gallon. They want to do 3 cents or 5 cents or 7 cents. But let's go with the high end, and let's say that's a 6% increase in fuel costs. Well, it will depend, of course, on your cost structure, but typically if you're running a van or shuttle service, fuel is sort of roughly 10% of your total costs. And so this could mean somewhere between maybe a 0.5% or a 1% increase in your costs for operating those vehicles. And we don't want to shy away from that. There could be cost increases for any purchase of gasoline on this program. But again, what that pool of money does is or the sale of those allowances does is it creates a pool of money that can then be redistributed back to users in ways that make our system run more efficiently. So in the case of Massachusetts, you could invest it back into roads and bridges across the state. You could invest it in our public transit infrastructure like the MBTA and the regional transit authorities and walking and biking. And then we also have a very successful program on the energy efficiency side called Mass Save, and probably some of your institutions have used those rebates and incentives to become more efficient as institutions. We could do exactly the same thing for vehicles. So just like you get that rebate or incentive for becoming more energy efficient, you could get rebates and incentives for making your fleet more efficient. And so these are the ways that hospitals and other providers would benefit from a TCI program. You get cleaner air for your employees and for your patients. You get increased statewide funding for transit operations, for walking and biking, forms and modes that many of your users, your patients, your employees are already using today. And then you get substantial improvements to rebate and incentive programs, and maybe even entirely new rebate and incentive programs for cleaner vans, shuttles, and other fleet vehicles, including for electric vehicles, which could eliminate your fuel costs entirely for those vehicles. Investing the TCI proceeds is going to take some conversation in terms of where we end up, and that's exactly where the states are doing now, both thinking about the regulation and then also thinking about the investment. And I want to quickly talk about, we won't get to all of these issues, but quickly talk about some of the important outstanding questions. The reason why this webinar today is so important and so timely is that the states are undertaking this process now, and it's important for them to hear from stakeholders about what your priorities might be for a TCI program. So they need to understand how the cap would work and where the point of regulation would be and what kind of price floor would be set. That's essentially the design of the market. The states need to hear from you about where you want those investment dollars to go. Is it more valuable to your institution to have increased public transit, providing access to your institution, or is it more valuable for you to have rebates and incentives for you to run your own shuttles, but have them be run in cleaner and more efficient ways? Really important question for the states. And then we also need to know, the states need to know, what are the complementary policies that they should put in place in conjunction with a TCI program? Should they be looking at things like congestion pricing, which New York City just passed? Should they be looking at vehicle miles traveled fees, or expanding the electric vehicle charging networks, or providing more rural transportation options? These are all things that would complement a TCI program that would make it work better for all of us that use transportation in the region. And the states want to make sure that they're doing these activities and these policies in parallel to the TCI program. Just taking a step back and thinking about this broadly, our transportation system across the region is not working. It's not working for commuters and employees. It's not working for patients or visitors or people that are shopping at shopping areas around the region. And it's especially not working for our environment and for our public health. And you heard Will walk through many of the arguments around public health. And again, transportation is the largest source of greenhouse gas emissions across the entire country, and a sector that is growing even as other sectors shrink. So we need some big and bold solutions to this problem, and it makes sense at the same time for us to look to proven models like RGGI, which has worked very well in these states, which has both given us the environmental benefits that we want and the public health benefits that we want, but also helped our economy grow faster than other parts of the country. We think TCI, as a cornerstone policy, can offer all of these things, and that's why we're hopeful to have your support as it moves forward with the states. And from there, we'll have John pick it up. Thank you.
Thank you so much, Chris. Yes, I'd like to introduce John Carlson, who is a state policy manager at Ceres. And give me just 1 second, John, and I'm going to pass you the presenter capabilities.
Thanks, Sarah. Okay, well, and thanks, Chris, for giving that wonderful overview and for everyone being here today to learn a little bit about the TCI process. And I'm going to spend some time talking about what that process actually is and the policy development and the spaces for stakeholder and public engagement and kind of what's coming up, especially over the next few months. So you can see here there's the kind of overall timeline for this year. It's important to note that the actual discussions around TCI, just as a working group, began a full decade ago in 2009. But then this commitment to working on an actual regional market-based policy really began in earnest through 2017, and the states began conducting listening sessions in 2018. And then at the end of 2018, in December 2018, 9 states in the District of Columbia officially announced that they would begin a process with the express goal of coming up with a very specific policy that would be a regional market-based policy to reduce emissions from transportation. One interesting thing to note about those 9 states in DC, which I'll come back to again in a few minutes, is that New York, which had been an active member of the working group up until that point, did not actually join the official policy development process in December. And we'll talk a little bit more in a few minutes about what states are involved and why and what that means for the kind of comments and stakeholder involvement that would be useful going forward. So the official development process is planned to go through 2019 with everything from kind of technical development that deals with reference models for the CAP portion and how that CAP is constructed, to a little bit more public and policy facing discussion about how is equity going to be included and how, if we're creating all of these revenues from the CAP side of the equation, how is this going to be invested and what are the best ways to invest it and make sure that, you know, the proper priorities are being reflected in those investments. So the stakeholder forums this year have primarily been constructed around 3 workshops, and those workshops have broadly focused on the topics I just mentioned: the design of the CAP, the equity considerations, and then the final workshop is going to be happening on July 30th in Baltimore, and that's going to focus on the investment side of the equation. How do we take these revenues and make sure that we're using them to create that modern transportation system, that we're using them to improve public health and to improve the lives of the communities that have been most burdened by the failures of our transportation system right now. Once those are complete, the states are going to take all of that information, all of those discussions, and develop something that looks like a model policy that then each of the individual states would have to figure out how to implement. And once you have the critical mass of states implementing that model rule, we'll start having a functioning market and some of those revenues being generated. So the next slide just goes a little bit more into detail in the stakeholder engagements that I was discussing during the timeline. So another thing to note is that in addition to actually showing up at these workshops, the states are allowing for public comments to be submitted that are being accepted in conjunction with those workshops. And so even if you're not able to travel to Baltimore, there really is still a wonderful way for the voice of the public health community and health systems to be heard. Now, so far as the process has been going forward, Series generally works with the business community, and there are different communities that have tried to make their voice heard. Series worked on a letter with support from dozens of businesses in the beginning of 2018 and some other involvement throughout that year. We also assisted another group called Second Nature, which works with universities to have their own letter of support and to make their own unique perspectives and interests heard in this process. And I think they had a little bit over 20 universities at that point engaging in the process that way. There is one other letter here that I would like to highlight that you can see on the slide, and that's something that we actually just released last week. That is a Massachusetts-specific letter that was a collaboration between ourselves, Series, the Environmental League of Massachusetts, but then, interestingly, the Massachusetts Taxpayers Foundation, the Business Roundtable, and the Associated Industries of Massachusetts. Now, these biz groups are essentially the largest chambers of commerce in Massachusetts, and this is really the first time that environmental and business groups have found themselves so aligned in the state. And we've gotten a great response both from policymakers, but from the public at large for this kind of collaboration. It really just goes to show that when you can have an unexpected messenger, it can carry an outsized voice. And we're really hoping to expand this type of model to the other TCI states. And we think that's important both for the support it demonstrates from the business community, but that I think it shows that while show of support from different communities like health systems or universities or business community is needed, it isn't necessarily controversial and isn't dangerous. What it does do, though, is it allows the policymakers to be more ambitious, and it makes sure that the unique interests, such as public health, such as protection of vulnerable communities, is front of mind of the policymakers while they are working on this rule over the next few months. Now, to go back to one of the things I touched on earlier, and I'm looking at the slide now, and I'm hoping you guys can see it a little bit better. It seems like some of the formatting may have been screwed up in translation, but I just wanted to give a quick overview of the states that are involved, because it's 9 states in the District of Columbia that are actively engaged in the policy process right now. But those states are not all essentially equal, and there are states that are outside of the official process right now, which we do expect to be involved in some way. Maine, for example, hasn't been part of designing this model rule, but officials from that state have been in contact with the working group. There is a lot of optimism that they will end up joining. Likewise, New York, as I mentioned, had been part of the working group, except when this official policy development process began last December, they decided not to sign on to that. To best of our understanding, there are some internal dynamics within New York that may have led to that, but the administrators from that state still have been discussing the TCI, the administrators from the other state, as the policy process continues to get developed. There is also a great hope that New York will rejoin. In fact, I would go so far to potentially say an expectation, but any push that the policymakers there, and especially the administration in New York, could get to make it clear that with this type of regional initiative that, as you can see from the map, completely surrounds New York and all of its neighbors are taking part, it's really essential that New York does not create this gap in the middle of the program. Now, those of you who are based in New York or followed the news there might be aware that they recently passed, just last week, an incredibly ambitious piece of legislation that I think the final version was known as the Climate Leadership and Community Protection Act. To some degree, I think advocates focused on TCI had been put on the back burner while that legislation took the foreground. But now that it's passed, I think it's very important to know that a lot of the advocates and the designers of these legislations had made a point of designing it so that TCI would be a complementary process. These do not, prohibit the other one from going forward. And that's also the case in many of the other states. For any individual states initiatives on the environment or transportation that don't involve TCI, a lot of the policymakers are already aware of the TCI process, and so they're thinking about how these things will work together, they'll complement each other and not take away from each other. To quickly go through some of the other states, there are places that we have a great deal of confidence are going to join and aren't going to have any problems, such as Massachusetts. Maryland has a Republican administration that has been supportive of TCI, as well as legislation that their assembly has passed enabling involvement. I think they're the first state that the legislature has clearly enabled involvement. One of the things to understand about implementing TCI, though, is that every state's needs in order to implement it will be slightly different. And we don't actually know what all of those will be until the final rule has been proposed at the end of this year. And so what I mean by that is most states will most likely be able to join by executive order, and no legislation will actually have to get passed. However, some states may require legislative authorization, and even the ones that don't necessarily require legislative authorization, you can see situations like in New Jersey and their involvement in the Regional Greenhouse Gas Initiative, the RGGI, which they were originally a part of, left under Chris Christie and are now rejoining. And so even if administrative action is the only thing that's necessary to implement the program, it's really important that a broad base of support be assembled so that administrations aren't by themselves, that whether it requires actual legislation or not, that there is a sense that the legislators and the policymakers in the community are behind this program. And to that effect, in Massachusetts, we have legislation that is going to be considered over this session, which actually goes through the end of 2020, that doesn't enable joining TCI, because the administration here can do that without any legislation, but it does discuss how the investments, how the revenue generated by TCI are going to get spent. And again, this gets back to one of the unique roles that health systems can play, and making sure that the proper kind of priorities are in play while the rule is designed and those investments are determined. More so than any other voice, you can speak to the public health benefits. It's incredibly important that we modernize, our transportation sector. It's incredibly important that we reduce emissions from this, what is now the greatest driver of climate change in the U.S. But with those things in mind, it's important that we don't lose benefit of the vulnerable and burdened populations that have suffered from the emissions and from the ozone and from the particulate pollutions. We need to make sure that the investments in the design of the program are addressing their concerns. And also, if those concerns are being adequately addressed, the health systems play a very important role in communicating that to those vulnerable populations and helping them understand that, efforts are being made to improve conditions. And so to take on that role, there are several things that you hear on this webinar in Healthcare Without Harm can be doing. And some of that is just if anyone is able to travel to Baltimore on July 30th and take part in the workshop, it is a public event. There is a link where you can register that I'm sure we'll be sending around, and you can go in person and you can make your voice heard that way. But with the understanding that most people aren't able to do that and aren't able to take, you know, a full day in the middle of the week to travel to an event like this. Sarah and Healthcare Without Harm have taken lead in drafting a sign-on letter that is going to be submitted just in advance of that workshop. So it'll be in the record. So while those discussions are happening on the 30th, it'll be in front of the policymaker's mind, and your voice and your perspective will be taken into account. And, you know, I believe Sarah is going to be sending around a draft of the actual letter once this webinar has concluded. But on this slide, you should be able to see the kind of the first page of it. And, you know, the main points are really the things that we've been talking about. It's to demonstrate that your community is aware of this process, that they support the goals of TCI, and that, you know, understand all the potential benefits that can come out of it. While at the same time highlighting the need for those benefits to be targeted at the vulnerable communities that have been overburdened thus far, and ensuring that the public health frame of mind is also in the policymakers' heads as they are coming up with this final rule, as they are making those decisions about investments, and as they're communicating it to all of the stakeholders. So with that, I think I will turn it back over to Sarah to discuss the letter a little more.
Thank you so much, John. Yes, we will absolutely be circulating this after the call, and we hope all of the health systems who are represented on the call today will review it and will consider signing on and sharing it with your government affairs. And if it would be helpful to set up a call with your government affairs offices, I would be happy to join that call with you if that is helpful as well. I did also want to open it up and see if there were any questions from folks. So feel free to type a question into the chat box for Chris or Will or John or myself, or you can also hover over your name and raise your hand. So we did have one question that came in, Chris, for you as you were speaking, and that question was about how exactly funds would be dispersed and accessed for hospitals for the types of investments you talked about. What will that look like?
Yeah, great question. So that's the type of policy that's under development right now, and that's why I think it's so important for hospitals and other providers to be weighing in on this conversation and highlighting that as an important need. In some states, they have pretty robust electric vehicle or van and shuttle incentive programs. In other states, they don't. And so what we want to see in Massachusetts, which is the state that I certainly know best, is a much more robust program than the one we have today through entities like Mass Save or like Mass Development, which are providing some funds today, but could be doing much more if they had more resources available to them. So it could be the expansion and growth of existing programs, or it could be entirely new programs that would be available to employers and other institutions that are operating these services that are essentially helping being part of the solution by getting people to carpool and vanpool together and to get more people moving in fewer vehicles. That's the type of system and behavior that this policy is trying to encourage and can really accelerate through the investment cycle that will happen with those TCI proceeds.
Thanks, Chris. That's very helpful. And then a couple of questions. Maybe, John, you can take these. One is, if I'm an individual physician and I don't represent a health system, would it still be important to weigh in on the development of this policy and how would I do that, and what would you recommend?
Sure. Again, if you're able to go in person to the workshop, that would be incredibly impactful. But even as an individual individual physician or nurse or member of a health system, the way to submit comments is open to anyone in the public. And again, I think we'll probably send along a link to that. It's the same website where registration for the actual workshop should be happening. And that way you can express your individual concerns directly to the policymakers. But then, you know, one of the large things is going to be, once the rule is developed and announced at the end of this year, is that method of implementing in the individual states. So, you know, any of the ways that you normally would engage within your community, with your own local representatives, with your own, you know, government and administration, you know, use those venues and express support for the goals and the efforts of TCI.
That's helpful, John. Thank you. Will, a question I think that you can take, and that was about health benefits. What's the time frame for realizing some of the benefits from reduction in pollution? Do those happen immediately, or are we looking at several years before we reap the health benefits? What is the research showing?
Well, the research that we put together on the zero emission vehicles, for example, we looked at phasing in vehicles over time. So as you're taking polluting vehicles out of neighborhoods and replacing them with zero emission, those are kind of more immediate benefits. But there have been more detailed long-term studies showing decade by decade, as air quality improves, lung health function, or lung function actually improves when you compare children living in those different generations or children living in different locations with various levels of pollutants. I'd be happy to kind of dig up some of that and show the two different ways of looking at it and share that with you, Sarah. The other thing that I would say is that if we're looking at something like a diesel truck, for example, that runs every day through your neighborhood, or the diesel school bus that carries children to and from school, and the health benefits of the switch from day one, if that electric school bus, for example, replaces a diesel school bus, that's immediate. That's the kids in that bus are experiencing less toxic diesel emissions from day one, and they'll benefit from that. On the last question, I just wanted to note that the Lung Association has a program called the Health Professionals for Clean Air and Climate Action, and that's a good opportunity, I think, if individual health professionals are looking for ways to connect to these types of policy engagement, to the extent that we have capacity in different states and different locations and are connected. I encourage folks to, you can get in touch with me and look at ways to link into that network of health professionals, physicians, nurses, respiratory therapists who are interested in taking action, and see what we are doing and see if there's a way to link up. So just wanted to flag that as well.
That's great, Will. Thank you. Maybe Chris can take this question. This is about, are there counter arguments to TCI, or who are the stakeholders that are opposing TCI? What are the arguments? It'll be helpful, this person says, to have that ready should their government affairs ask when they bring the letter.
Sure. So I think there's always an expectation that the petroleum industry is going to push back on this policy because they will see it as new regulation and potentially increasing their cost structure. Now, at one of the listening sessions that TCI held, I was across the table from the ExxonMobil lobbyist for the Northeast, and he gave me the impression that to some extent they appreciate that this is coming, and in fact, ExxonMobil now broadly supports carbon pricing, and they see this as a step in that direction and a sort of reasonable and moderate one. So we were actually pleased to hear that, and hope that the petroleum industry will continue to sort of watch this closely, but not outright oppose it, as we might expect them to do. I think the other concern is a political one for our elected leaders, that this is a policy that could eventually raise fuel prices. Now, that was the claim that was made about RGGI, and in fact, electricity prices came down in the decade since it was put in place because things got so much more efficient, and we could see the same thing in transportation. But there is some political risk there, and that's why it's so incredibly important for hospitals and other institutions to step up and say to elected leaders that this is a priority policy. If they don't see that support and that backing, then they might get skittish on this, and we don't want that to happen. We want this program to be robust and equitable so that it's reducing as much pollution as possible, generating as much resources as possible for cleaner investments, and that it's doing that in a fair way.
That's very helpful, Chris. Thank you. Any other last questions? If you don't have additional questions, I just wanted to share my email if there was any further additional questions that you have that come up. And like John said, we will be sharing the letter with you for your review. We hope all of you sign on. And Healthcare Without Harm's Climate and Health Program has a variety of ways that you can get involved to reduce healthcare's climate impact, as well as advocate for climate solutions at all levels. And so you can see our webpage there, noharm.org/climate and health. And so we hope to hear from you. All right. Thank you, everyone. And thank you so much to our presenters, especially Will, Chris, and John. Have a good afternoon, everybody. Bye-bye.